Welcome to Cash&Crest. Here is a number that should make you uncomfortable. 1 in 3. That is how many families across the UK, the United States and Canada will face a significant medical expense this year they were not expecting, not planning for, not ready for. And most of them will handle it one of two ways. They will drain their savings, or they will go into debt. Because medical emergencies do not wait until payday. They do not care that rent just went out. They just happen, and then the clock starts. These 3 countries have completely different healthcare systems, different rules, different risks, different financial traps. But here is what is identical across all 3. Ordinary families are getting caught out. In the United States, a 3-day hospital stay averages $30,000. A single ambulance ride before any treatment is $1,200. And 25 million Americans have zero health insurance. Not because they do not want it, because the system makes it genuinely hard to access and afford. In Canada, the public system covers the basics, but not prescriptions outside hospital, not dental, not vision, not physiotherapy or private specialists, and the waiting times. The median wait for specialist treatment nationally is 27.7 weeks. In some provinces, over 40 weeks. Covered does not mean fast. Most Canadians find that out too late. In the UK, there are currently 7.5 million people on NHS waiting lists. The average consultant referral wait is over 18 weeks. NHS Dental, in large parts of the country, is not accepting new patients at all. The NHS remains one of the great institutions of the modern world, but it is operating under a volume of demand it was never built to handle, and ordinary families are absorbing the consequences. Here is the uncomfortable maths underneath all of this. In every country, there is a gap between what the system can reliably deliver and what your family actually needs. And that gap has a cost. The question is not whether you will pay it. The question is how. Option 1. Monthly health insurance. Predictable, manageable, spread across time. Option 2. Out of pocket when something happens. Unpredictable, potentially devastating, all at once. Option 3. You wait in the public system and absorb the non-financial cost. The time, the uncertainty, the delayed diagnosis, the condition that could have been caught early, but was not. There is no fourth option. Here is what health insurance actually covers beyond emergencies. Fast GP appointments, same week, sometimes same day. Specialist consultation without waiting months. Mental health support now, not in 14 months. Physiotherapy, dental, optical, prescriptions. And if something serious happens, private rooms, your choice of consultant, treatment in days, not months. This is not a luxury product. This is a different relationship with your family's health entirely. Here is the part that rarely gets said directly. The families who most need health insurance are almost always the ones who tell themselves they cannot afford it. The self-employed parent with no sick pay. The household with no financial buffer. The family managing fine right now until one serious illness changes everything. The average age people take out their first health insurance policy in the UK is 43, which means most people spend their 20s and 30s when premiums are lowest and coverage is broadest, completely uninsured. Then, they try to get covered in their 40s and 50s when costs are higher and exclusions are more numerous. The system rewards early action and quietly punishes delay. So here is the question I want to leave you with. If something happened to someone in your family tomorrow, not someday, tomorrow, how long would they wait? And what would that wait actually cost you? Not just financially, in every sense. Most people never ask that question until they are already inside the answer. Do not be most people. If this video made you think, subscribe to Cash&Crest for more videos that help your family make smarter financial decisions.